It's important to be prepared for your operation. If you have children, elderly parents, or any other dependents, make care arrangements in advance so that you don't need to worry about them whilst you're in hospital. Arrange how you'll get in and out of hospital, and ask a friend or family member to be with you for 24 hours after the operation. The medications you'll be given in hospital can make you drowsy, and so it isn't safe to drive. It's also important to have someone with you in case you develop a complication and need them to call for help. Most hospitals will send you home with a supply of pain relief medication for use after your operation. However, it is advisable to stock up with simple painkillers such as paracetamol and ibuprofen, as some hospitals do not supply these. Please contact us if you aren't well in the week before your operation. Follow the advice you were given at the pre-operative preparation appointment regarding specialist drinks, fasting plans, and stopping or changing medications. If you aren't sure what to do, contact your GP or the pre-op clinic for advice. Try not to bring too much stuff with you into hospital, as there's a limited amount of room. Bring your medication. This will be stored in a cupboard by your bed and will be checked by the hospital pharmacist. Bring sensible footwear, such as supportive slippers. Don't bring dirty shoes or flip-flops, as these are not safe to wear in the hospital. Bring a dressing gown and pyjamas. Even though you'll be in a hospital gown for the operation, it's nice to be able to change into your own clothes afterwards. Bring basic toiletries with you, including a toothbrush, toothpaste, and deodorant. If you have a mobility aid, such as a stick or frame, a hearing aid or glasses, bring them with you. There's often a lot of waiting around in hospital, so bring a book, newspaper, game or tablet, but remember, these items are your responsibility. Don't bring valuables with you, and only bring a small amount of money, for example to buy a newspaper. We can put some items in the hospital safe. Of course, if you're only coming in for a day case, you'll not need to bring as much with you. On the morning of your operation, have a wash or shower before you come into hospital. You may have been given a special body wash to use. Remember not to wear any jewellery apart from your wedding band, or makeup or nail varnish. If you have any questions about what to do in preparation for your operation, speak to the specialist nurses at the pre-operative appointment or speak to your GP.